everyone, welcome to Acute TV. I am your host Rajni Bharara, and today on the show I have with me again a very special doctor. His name is Dr. Sharath Chandra, and today on the show we are going to speak with him about complications of COVID-19, and he is a pulmonologist. So we are going to, like I mentioned, ask him about the complications of COVID-19. But before, let's welcome him to Acute TV. Hello, doctor. Welcome to Acute TV.
Hi. Good evening.
Good evening. So, doctor, I already have actually told about you that you're a pulmonologist. But if also, by yourself, if you can please introduce yourself to the audiences.
So, I'm Dr. Sharath Chandra. I'm specialized in pulmonology. I completed my PhD and advice in fellowship in intensive care medicine. And I'm the founder and director of O2 Pulmonary. So, it's Oxygen Pulmonary, Pulmonary.
Okay, that's great. I'm sorry?
The practice in Hyderabad.
Okay, your practice is in Hyderabad. Okay, that's absolutely amazing. That's great. And now, doctor, moving on to the topic of discussion, which is the complications of and sequelae of COVID-19. So I actually would like to know from you, if you can please talk about how does coronavirus affect the lungs, and also how does it causes breathlessness in one person?
So the term the COVID-19 causes happy hypoxia. Actually, the term happy hypoxia is very much important in the progression of this disease. So, coming to the pathophysiology, pathogenesis of the shortness of breath in COVID-19, that occurs mainly due to the vacuum mismatch. That means, in general language or general terms, what you say, whatever the air or oxygen that you inhale into your body, into your lungs, will not go into the blood.
Mm-hmm.
There will be perfusion disturbances, and the diffusion of the oxygen into the blood will be impaired.
Mm-hmm.
This is called as a diffusion mismatch or diffusion impairment. Because of this, the oxygen, whatever the air or oxygen, whatever we take into our lungs, will not reach the blood. The main reason for this is there is a tissue called interstitium between the alveoli, that is the air sacs and the blood. So this tissue is infected. It's the COVID-19 infection leads to the interstitial disease. Due to this, the diffusion, the transfer of oxygen from the alveoli to the blood vessels are impaired.
Mm-hmm.
This is symptoms of dyspnea, that is shortness of breath.
Okay. But doctor, also my question to you is, there was a lot of news, which actually, there was a lot of news where it was said that if you plant more trees or if you grow more trees, so it is going to help you in breathing. So you should plant more trees. So what would you like to say about that? And how would you like to say, compare both the oxygen? One is the industrial oxygen as well as the environmental oxygen.
So the concentration, the fraction of inspired oxygen will be high in the oxygen cylinders. That is, we can increase from 21% to 100% by the help of this invasive ventilation or non-invasive ventilation, like ventilators and all. But the fraction of inspired oxygen in the environmental air is just 21%.
Okay.
We can give high concentrated oxygen.
Mm-hmm. Mm-hmm.
So there will be different levels of FiO, that is the fraction of inspired oxygen, depending on the oxygen level that we are giving. For example, from 1 to 4 liters of oxygen that we give, it increases the FiO increases about 3. For example, if normal fraction of inspired oxygen in the environment is 21%.
Mm-hmm.
If you put a patient on oxygen with 1 liter or 2 liters, for example, 1 liter, so it becomes 21 plus 3.
Mm-hmm.
For example, if we put him on 2 liters of oxygen, it becomes 3 into 2, that is 6 plus 21. So the fraction inspired oxygen will become 27 if we put him on 2 liters.
Yeah.
So after this becomes almost like this. For example, if we put him on 6 liters of oxygen, it becomes 3 into 6, 18 plus 21. That is 37%. So we are giving the high concentrated oxygen.
Okay. So, doctor, so the confusion that was made by the media or the news outlets that you should plant more trees, and this is the cause because we are cutting down trees and all these things. So this is just a made up thing. So both the oxygen in our lives are equally important, and we should not confuse ourselves with these two different oxygens. You are saying?
Correct.
Okay.
Studies also states that the pollution index, the countries which are highly polluted and whose
Yeah.
pollution index is very high, they are in those countries the COVID cases are very much proportionately they are higher. So
Mm-hmm.
pollution plays a major role in this COVID-19 infection. So it's advisable to plant trees because it decreases the pollution.
Yeah. Yeah. I mean, absolutely. But you should not confuse it with the other form of oxygen that you. Yeah. Yeah.
See, in the whole environment, the FiO, the fraction of inspired oxygen, will be 21%.
Mm-hmm.
But, yeah, we can increase the oxygen, but it's not like we can increase the fraction of inspired oxygen.
Yeah. Absolutely. Absolutely.
Concentration we can't increase. The amount of oxygen in the air we can increase, but we can't increase the fraction of the concentration of oxygen that goes into our lungs.
Okay. Thank you for clearing out the confusion and thank you for making it clear to the audiences. So now moving on to my next question, which is, so does COVID-19 cause long-lasting lungs problem?
Yeah, see, the most common complication of the COVID-19 is lung fibrosis, that is pulmonary fibrosis. Pulmonary fibrosis, see, the COVID-19 infection, it affects the interstitium, as I mentioned before. After some days, the interstitium will become fibrosed. So this results in the restrictive lung.
Okay.
Restrictive lung means the lung can't expand adequately. There will be restrictive lung deformity in the lungs. Restricted deformity in the lung. So it will be difficult for maintaining saturation. It's called as pulmonary fibrosis. The most common complication or most dangerous complication is this pulmonary fibrosis. And there are other complications too, like the recently everyone's have seen in the newspapers or in the TVs, the mucormycosis, and the secondary bacterial infection will be the secondary bacterial infection will present in the patients who are recovered from COVID-19, like pneumothorax and many other infections. The oxygen taking capacity of the lungs will be decreased.
Okay. So even after we get recovered with the virus and even after we get recovered with COVID-19, so we still have to take care of our lungs and ourselves, a bit more than we used to earlier because it might be harmful. Okay. So now, doctor, moving on to my next question. So what is acute respiratory?
Yeah. I forgot to mention one more thing, that is cardiovascular complications of the COVID will also be there because that's why we keep on checking this D-dimer levels in patients who are affected with COVID-19. And the patients who are infected with COVID-19 or post-COVID infections, there will be some sort of this thromboembolic disease, some clots in the blood which goes to the lung or even the brain or the heart also, that results in the blockage of the blood because there's pulmonary embolism.
Okay. So we have to keep medically we have to keep ourselves visit doctors and Okay, so now, doctor, also I would like to know from you that what is acute respiratory distress syndrome COVID-19? If you can also please elaborate a bit about it.
See, acute respiratory distress syndrome, it's been formed during the Second World War. The soldiers or the people who are involved in the Second World War, it's almost like Vietnam, I guess. So they got affected with this ARDS. It's then termed as a stiff lung. Patients got dyspnea, that is, they were suffering from shortness of breath. So suddenly they were admitted to the hospital and adequate ventilation was provided to the patients. Even though their saturations didn't increase. So it's called as a stiff lung, because even after giving the oxygen, the lungs are not expanded without the saturation. This was then termed as the stiff lungs. And later on, as years progressed, it's termed as ARDS, acute respiratory distress syndrome. In this, the main pathophysiology is diffuse alveolar damage. Diffuse alveolar damage is the main pathophysiology of this ARDS. And according to the Berlin's criteria, that is the criteria which we use to define ARDS, according to the Berlin's criteria, ARDS is defined as decrease in this partial pressure of oxygen, the oxygen levels in the body decrease levels even though after giving adequate concentration of oxygen through oxygen cylinders or ventilators, something as I told you before. Even after giving large concentration of oxygen, also the partial pressure of oxygen in the arteries, the blood, they don't increase. It is again graded into three types. Grade 1 and grade 2, depending on the ratio of PaO2 by FO2, the partial pressure in the body, and then the fraction of inspired oxygen in the lungs. PaO2 by FO2. It is again graded into the ratio is divided into three forms, that is 350, 250, and 150. If it is less than 350, it is grade 1, 250 grade 2, and 150 grade 3. So this ARDS in COVID, it occurs, because of this interstitial damage. Even though after we give adequate concentration of oxygen, the oxygen saturation doesn't increase. It's termed as respiratory failure, ARDS.
Okay. So with this, doctor, I would also like to know from you that, could smoking or vaping make you more susceptible to the COVID-19 harms or the virus?
Yeah, vaping is almost banned in India, where in other countries, the people vape, they take the vape. So vaping causes this disease named as chemical pneumonitis.
Okay.
They go into the lung and they destroy the lung. This is called as chemical pneumonitis. And in India, it's banned in India. And coming to the smoking, obviously the smokers have bit decreased immunity. They have some changes in the lungs called as emphysematous changes. In the long-term smokers, they will be affected with this disease known as COPD, chronic obstructive pulmonary disease. So there will be some obstructive defect. There are two types of defects in the lung. There is obstruction and restriction. So these smokers, they develop obstructive lung disease. So obviously, the saturations will be below, the baseline saturations will be low. If they are infected with COVID-19, the symptoms aggravate. The symptoms of shortness of breath aggravate very easily. The cough aggravates very easily, and the chest pain sort of.
Okay. So we have to be more careful regarding smoking, especially if we have got the virus.
I've seen, according to my personal, I've seen in my patients, the smokers, they develop this pneumothorax, that is the lungs, air in the lungs, air in between the pleura. But there is a cover in between above the lungs, that is the parietal pleura and visceral pleura. The air in this between this parietal pleura and visceral pleura, that's the pleural space. The air into the space and it's called as pneumothorax. So it compresses the lungs depending on severity, and even the whole hemithorax, one side of the lung gets collapsed, and these occurs in mainly smokers.
Okay. I hope the audiences are listening, and I hope they're listening to you, and all the smokers out there. You really have to be careful, and you should actually, because of the pandemic that has happened and the virus that have come. So because of that, I think everyone should quit smoking and should be more careful about their health. Okay, now, doctor, moving on to my next question. Also, could poor air quality make you susceptible to COVID-19 harms and to the virus? Because there's so much pollution in the air, especially in cities like in places like Delhi, Mumbai, because of the traffic, industries, and all those things. The air is polluted. So could the quality of air can also make you susceptible to the virus?
As I told you before, there are no proper studies depending on the connection between the air pollution and the infectivity of the COVID-19. But as you see the pollution index of individual countries, the COVID-19 cases are increased. The proportion of the COVID-19 cases are increased in the countries where the pollution index is high. So we can relate. If there is any pollution, there will increase COVID-19 cases.
Okay.
So that there is no proper article or any studies on that. But there is a relation like increased pollution index, increased countries and increased pollution index, where the number of cases of COVID-19 is high. So we can read each other.
But as a doctor, would you recommend your patient air purifier?
Air purifier, air purifier. Obviously, as a pulmonologist, I suggest to say air purifier. Stay away from pollution, stay away from the dust, because it causes the lung, pathogens. So I suggest them to stay away from this pollution, dust, smoking.
Okay. Okay, great. So also, doctor, the country is actually asked to wear the mask and the shield to not spread the virus. If you have gotten infected with the virus, so that you don't spread the virus, they have asked the country. I mean, the government have asked you to wear the mask, and also it's one's responsibility, obviously, to wear the mask and to avoid public gatherings. But here is my question. So, a lot of people who have asthma and who have breathing problems. So when they wear the mask, they actually have a problem in breathing. So what would you like to suggest them? What should they do about it?
See, what you told, that is a chronic lung disease or long-standing lung disease. Those are the patients who have asthma or COPD.
Yeah.
They are mostly affected. Why? Because the baseline saturation, that is, in normal people, the baseline saturation will be 97 to 99, but it is decreased in the patients with COPD and asthma. COPD means chronic obstructive pulmonary disease.
Okay.
It's mainly in smokers and in any industrial exposure patients. So, and second thing is asthma. So, in these patients, the baseline saturations will be low. Yeah, if you put a mask, there will be some sort of dyspnea, that is breathlessness that will be there. But recently, the European Thoracic Society, the Respiratory Society, ERS, European Respiratory Society, it has released a paper stating that this N95 mask in COVID, in this COPD patients or in asthmatic patients, they don't affect the saturation. So N95 mask we can suggest in this patient. But as a doctor, as a pulmonologist, as I advise the patients with long-standing disease like ILD, disease, or COPD, or in asthmatics also, to stay away from all to be in quarantine, to be at home. I don't advise go out and to the normal world. They should be away from it because the chances of infection of COVID will be high.
Okay. So
once they're infected, the post-COVID complications will be high. There'll be easily lung fibrosis in those patients. So I suggest them to stay at home.
Okay, so there are no substitute for the mask, there's no substitute for the shield. You will have to wear it.
Yeah.
Okay.
The European Respiratory Society, they told that they conducted a study and they told that this mask should be used in the patients with COPD and asthmatics also.
Okay, great. With this, one more question to you is, are people with, I think you already have answered it, that they are at a higher risk of catching the COVID virus. So, but doctor, here's my last question before I let you go, is what can we expect from the third wave that has actually been making quite a, hot topic for the news channels today in today's time?
Even in the morning also, if I go to the hospital, if I go around, there is the pollution, the fog, so the traffic and the people, roaming around. I see them and I just I'm a bit afraid of the third wave. Yeah, because of this, the COVID cases will increase. If there is any COVID, the COVID cases will increase. So the third wave might come in India. And compared to this, there are high chances of third wave in India. Because the pollution is crowding and the number of the high pollution population, the pollution, and the people don't stay at home; they keep from.
Yeah.
The chances of third wave is high. And coming to the mutation, there's a concept of mutations. There are high mutations in this COVID-19. The virus which came in its first wave, the underwent mutations, and then second wave the virus might be a bit different. So if it is highly dangerously mutated, the chances of recovery from the COVID-19 disease in the third wave, it will be very difficult. It's better to prevention. As I say, prevention is better than cure. You have to prevent the disease, stay at home, and maintain some hygiene. If anyone gets infected, in other countries like Europe and US, there already the third wave has been detected. So let's see the studies, and within 1 or 2 weeks the studies may come, and then we can come to a conclusion.
Okay, great.
As one person, I think that COVID third wave might be a bit dangerous than first and second.
Okay, so is it more harmful for the kids, like it has been said?
There's a multi-system involvement in children that is called as MIST in children. It's not a multi-organ system. So it not only affects the lung, the other organs will also be infected.
Oh, okay. Okay. So I think we have to be
Yeah.
really, really careful this time. Okay.
Yeah.
Thank you so much, Dr. Sharath, for coming to Acute TV and speaking with us. Thank you so much for giving us these information, which is actually very, very helpful for everyone. So thank you again for taking out time and coming to the channel.
Thanks.
All right, guys, that's it from Acute TV. Keep on watching and